What are the blood vessels and the nerves that supplies and innervates the different structures in the oral cavity? Trigeminal nerve provides innervation to the different structures in the oral cavity. Trigeminal nerve, cranial nerve 5, is the largest cranial nerve and it is the major sensory nerve of the face and scalp. It originates in the semilunar or trigeminal ganglion on the semilunar fossa in the petrous portion of the temporal bone. It has three major divisions: the ophthalmic, the maxillary, and the mandibular divisions. V1 and V2 are both sensory, while mandibular, or V3, has both motor and sensory nerve fibers. The trigeminal nerve provides sensory innervation to the skin of the face, teeth and jaws, periodontal ligament, and the temporomandibular joint. From the semilunar ganglion, the trigeminal nerve exits the skull through three different foraminas. This is a picture of a skull, human skull, from the superior view showing the bones lining the inside of the neurocranium. V1 or ophthalmic nerve exits the skull via the superior orbital fissure. V2 exits the skull via the foramen rotundum. And lastly, the mandibular nerve or V3 exits the skull through the foramen ovale. This is a picture showing the trigeminal ganglion, its three branches, and how or where these three branches exit the skull. This is V1 exiting the skull through the superior orbital fissure, the maxillary nerve or V2 exiting the skull through the foramen rotundum, and V3 or mandibular nerve exiting the skull through the foramen ovale. This is a sagittal view. The trigeminal ganglion is cut here, but you can see the three branches of the trigeminal ganglion or the trigeminal nerve exiting the skull through three different foraminas. Ophthalmic nerve or V1 has three divisions: the smallest lacrimal nerve, the largest frontal nerve, and the nasociliary nerve. This is another picture showing V1 exiting the skull through the superior orbital fissure, giving off its three main branches: the lacrimal branch, the frontal branch, and the nasociliary branch. Again, division of trigeminal nerve is purely sensory. Its branches supply general sensations, including touch, pain, pressure, and temperature to the skin of the upper third of the face. This area here is innervated by the ophthalmic nerve. This includes the skin of the forehead and anterior scalp, the skin around the eyeball, eyelid, and nose, and part of the nasal mucosa and maxillary sinus. The ophthalmic nerve does not supply the oral cavity, and it is more related to the supply of the orbit or the eye, hence its name. The maxillary nerve, on the other hand, provides general sensations of touch, pain, pressure, and temperature to the skin of the middle third of the face and the palate. It also provides sensory branches to the pulp of all maxillary teeth. After passing to the foramen rotundum, the maxillary nerve passes into the pterygopalatine space and eventually splits off into four branches: the pterygopalatine, posterior superior alveolar, infraorbital, and zygomatic nerve. The first branch of the maxillary nerve The pterygopalatine nerve splits off closest to the foramen rotundum. A branch of this nerve, called the descending palatine nerve, passes through the greater palatine foramen to become the greater palatine nerve. This is the greater palatine nerve entering the oral cavity through the greater palatine foramen. The greater palatine nerve spreads anteriorly to supply the mucosa or soft tissue covering of the posterior portion of the hard palate and the palatal gingiva medial to the posterior teeth. Posterior to the greater palatine foramen, the middle and posterior or lesser palatine nerves enter the palate through the lesser palatine foramen and spread posteriorly to supply the tonsils and mucosa of the soft palate. This is the lesser palatine nerve entering the lesser palatine foramen. Another long branch of the pterygopalatine nerve is the nasopalatine nerve. In this picture, the nasopalatine nerve is cut, but here you can see the path of the nasopalatine nerve. It runs along the roof of the nasal cavity, then diagonally downward and anteriorly along the nasal septum, where it enters the bone of the palate to emerge onto the anterior palate through the incisive foramen here. This branch innervates the soft tissue of the nasal septum and gingiva and palatal soft tissue lingual to the anterior teeth. Just before the maxillary nerve enters the infraorbital fissure and canal, on the floor of the orbit, it gives off its second branch, the posterior superior alveolar nerve or PSAN. This branch enters the alveolar canals on the infratemporal portion of the maxilla. Once within the trabecular or spongy bone of the maxilla and the maxillary sinus, its dental branches enters the small opening in their tooth roots to supply the maxillary molars, except the meshobuccal root of the maxillary first molar. It also innervates the supporting alveolar bone, periodontal ligaments, and facial gingiva next to the maxillary molars, the mucosa of part of the maxillary sinus, and cheek mucosa next to the maxillary molars. In the pterygopalatine space, a third branch of the maxillary nerve splits off and passes through the inferior orbital fissure on the floor of the orbit and enters the infraorbital canal, where it becomes the infraorbital nerve. While within this canal, the infraorbital nerve gives off two branches, the MSAN or middle superior alveolar nerve and the anterior superior alveolar nerve or ASAN. MSAN gives off dental branches that enters the premolars and the meshobuccal root of the maxillary first molars, their supporting alveolar bone, PDL, and facial gingiva and part of the maxillary sinus. Here is the infraorbital nerve. This is MSAN. This is ASAN. You can see here that MSAN provides innervation to the premolars, maxillary premolars, including the meshobuccal root of the maxillary first molar. ASAN, on the other hand, gives off small branches that supply the pulp, supporting structures, and facial gingiva of the maxillary anterior teeth here. You can see the ASAN here, and part of the maxillary sinus. After exiting the infraorbital foramen, the infraorbital nerve splits into its terminal branches. The nasal nerve, innervating the skin and mucosa of the side of the nose. The palpebral nerve, innervating the lower eyelid. And the labial nerve, innervating the upper lip, facial gingiva of maxillary premolars, and the anteriors. The last branch of the maxillary nerve is the zygomatic nerve here. The zygomatic nerve arises in the pterygopalatine fossa, enters the orbit via the inferior orbital fissure, and then divides into the zygomaticotemporal and the zygomaticofacial nerves. It supplies the skin of the temporal region and the lower part of the orbit. This is a table showing, summarizing the V2 or maxillary division of the trigeminal nerve, its main branches, and its smaller branches. This is another summary including the structures that are innervated by the following branches of the maxillary nerve. V3 exits the neurocranium via the foramen ovale. This is V3 exiting the foramen ovale, exiting through the foramen ovale. It passes into a space just medial to the zygomatic arch. The zygomatic arch in this picture is removed, as well as the mandibular ramus. This space where the mandibular nerve passes through is called the infratemporal space, as it passes inferiorly toward the mandibular foramen. In the internal surface of the mandible, it divides into four sensory branches: the auriculotemporal nerve, the buccal nerve, the lingual nerve, and the inferior alveolar nerve, or IAN. The auriculotemporal nerve comes off the main trunk immediately below the skull, turns back to supply pain and proprioception fibers to the TMJ, and to supply the skin of the outer ear and lateral aspect of the skull and the cheeks. The buccal nerve is also referred to as the buccinators or the long buccal nerve. It comes off just below the foramen ovale and passes through the infratemporal space between the two heads of the lateral pterygoid muscle. Then down forward to the buccinator muscle here. Here it innervates the mucosa and skin of the cheek up to the corner of the mouth and buccal gingiva in the area of the mandibular molars and sometimes the second premolars. The lingual nerve branch passes downward, medial to the ramus, but lateral to the pterygoid muscle, to the mucous membrane just lingual to the last molar. It provides general sensations to the anterior two-thirds of the tongue and adjacent tissues, including the mucosa on the floor of the mouth and inner surface of the mandible and the lingual gingiva of the entire mandible. The inferior alveolar nerve comes off the mandibular nerve on the medial side of the lateral pterygoid muscle, roughly paralleling the direction of the lingual nerve, to descend between the spinomandibular ligament and ramus, where it gives off the mylohyoid nerve. This is the mylohyoid nerve. The mylohyoid nerve pierces the spinomandibular ligament and travels forward in the mylohyoid groove to supply the mylohyoid muscle. This is the mylohyoid muscle and the digastric muscle here. The IAN then enters the mandibular foramen, and inside the mandibular canal, it gives off many small dental branches that supply all mandibular premolars and their supporting structures. It splits near the roots of the premolars to become the mental nerve and the incisive nerve. The mental nerve branch exits from the body of the mandible through the mental foramen to supply the facial gingiva of the mandibular incisors, canines, and premolars, and the mucosa and skin of the upper lip and chin on that side up to the midline. The incisive nerve, on the other hand, continues forward within the mandibular canal to supply the mandibular anterior teeth and their supporting structures. Okay. You can see here the inferior alveolar nerve splitting into the mental nerve which exits through the mental foramen, and the incisive nerve which continues within the canal to supply the anterior teeth. The mandibular nerve is the only motor trigeminal nerve. These are the motor branches of the mandibular nerve or V3 and the muscles that they innervate. This is a table summarizing the main branch and the smaller branches of the mandibular nerve of the cranial nerve 5 and the type of nerves these branches are. This is another table summarizing or including the different structures that these branches innervates. Notice here that the sensory branch of the mandibular nerve is also referred to as the anterior division, while the motor nerve is the posterior division. These are the other structures that also receives innervation from various nerves. The tongue is innervated by four types of nerves. Lingual nerve of cranial nerve 5 provides sensory innervation to the anterior two-thirds of the tongue, while taste sensation is provided by the chorda tympani branches of the cranial nerve 7. Both sensory and taste innervation of the posterior one-third of the tongue is provided by the glossopharyngeal nerve or cranial nerve 9. The muscles that moves and changes the shape of the tongue is innervated by the hypoglossal nerve. Most muscles of the facial expression is innervated by the facial nerve. The facial nerve is also secretory to the submandibular and sublingual salivary glands, while the parotid gland receives sensory innervation or receives sensory innervation from the glossopharyngeal nerve. Next, we'll discuss the vessels that are associated with the oral cavity. The artery that supply the structures in the oral cavity arises from the external carotid artery. As the external carotid passes superiorly, it gives off three important branches to the mouth: the lingual artery, the facial artery, and the maxillary artery. General anatomy teaches us that blood vessels and nerves come in threes. If there is a lingual artery, there is also a lingual vein, and there is a lingual nerve, the three being parallel in its course and supplying and draining the same structures. Lingual artery is the first branch of the external carotid artery, and like the lingual nerve, it supplies the floor of the mouth, the adjacent gingiva, and also the sublingual gland. Second, the facial artery, together with the facial nerve, pass together through a shallow notch on the inferior border of the mandible just anterior to the insertion of the masseter muscle. There are four branches of the facial artery that we will describe. The first one is the ascending palatine artery. It supplies the soft palate, the pharyngeal muscles, the mucosa of the pharynx, and the palatine tonsil. Next is the submental artery, which provides blood supply to the floor of the mouth, the mylohyoid muscle, including the lymph nodes found inferior to this muscle, and the anterior belly of the digastric muscle. Next is the labial artery, which has two branches, the inferior and the superior labial artery, which provides innervation or blood supply rather to the lips and to the orbicularis oris. The terminal branches of the facial arteries are lateral nasal and angular branches. The third branch of the external carotid artery is the maxillary artery. The branches of the maxillary artery can be considered in three parts. The mandibular part and the pterygopalatine part are directly involved with the blood supply of the mandibular and maxillary teeth, while the pterygoid part provides blood supplies to the muscles of mastication. The mandibular part of the maxillary artery includes the inferior alveolar artery here. Inferior alveolar artery, like the inferior alveolar nerve, enters the mandible through the mandibular foramen, supplies branches to the mandibular posterior teeth, then divides into two branches, the mental artery and the incisive artery, which parallels the mental nerve and the incisive nerve respectively. The pterygoid part of the maxillary artery supply blood to the muscles of the mastication. Its, its branches include the posterior and anterior dip temporalis to the temporalis muscle, the masseteric artery to the masseter muscle, the pterygoid branches, and a buccinator branch here and here. The branches that come off the third part of the maxillary artery supply the maxillary teeth and their periodontal ligament. The posterior superior alveolar artery here provides blood supply to the maxillary molars. The infraorbital artery within the infraorbital canal gives off the middle superior alveolar artery that supplies the premolars and the anterior superior alveolar artery that supplies the anterior teeth. The descending palatine branch supplies the mucosa of the hard and soft palate and the palatal gingiva. When it comes to the venous drainage of the structures in the oral cavity, the inferior alveolar vein drains the mandible and its teeth or the area supplied by the inferior alveolar artery. It then carries the blood to the pterygoid plexus, which is a network of veins that collects blood through the deep veins here that drain the upper part of the face, the tissue of the lips and muscles around the mouth, the posterior part of the nasal cavity, the palate, the maxillary alveolar process, and maxillary teeth. The veins of the pterygoid plexus then empty into the short maxillary vein, and while within the parotid gland, blood from the maxillary vein passes into the retromandibular vein to drain those areas that had received blood through the maxillary arteries. The retromandibular vein drains into the facial vein, where it becomes the short common facial vein that then empties into the internal jugular vein. Another important vein that also drains blood from the face is the facial vein. This entire vein here is the facial vein. This is the common facial vein. The facial vein roughly follows the course of the facial artery and receives blood from the area around the eyes, the nose, the lips, and it can also receive blood from the muscles of mastication. The facial vein empties through the common facial vein and then into the internal jugular vein. Blood from the tongue drains through the lingual veins that also empties into the internal jugular vein. Once blood reaches the internal jugular vein, it passes into the brachiocephalic vein to the superior vena cava and then through heart and lungs to become oxygenated. For the lymphatic drainage of the different structures in the oral cavity, these are the nodes that we need to take note of, and the structures that they drain. Note that the submental lymph nodes drains into the submandibular lymph nodes. The submandibular lymph nodes and the parotid or preauricular lymph nodes then drains into the deep and superficial cervical chain of lymph nodes. These are the references which you can read further in order to better understand and picture the blood supply and the nerves of the oral cavity.